Welcome back to the morning show here on Arise News. Our first guest is a medical doctor, a lactation consultant, and a member of the Academy of Breastfeeding Medicine. She is also the founder of the Milk Booster and the Breastfeeding Doc, which aims to help expectant and nursing mothers overcome the hurdles that comes with breastfeeding. She is set to launch her foundation, the Milk Bank, which will provide breast milk for premature babies in hospitals, and hopes to provide breast milk across Nigeria to replace alternative milk formula. Dr. Chinny, welcome to the show.
Welcome to the morning show. Great to have you.
I'm glad to be here.
So it's World Breastfeeding Week from August 1st to the 7th of August.
Yes.
So tell us what really goes on during that week.
So basically it's just to create more awareness, to educate, to support mothers, and to encourage organizations to kind of make more room and accommodate nursing mothers coming back to work and to increase maternity leave. So it's just more of telling them what should be done, the changes that will benefit them as well as mothers.
Wow, so you are based in Ireland, correct? Yeah. And you have been, you just come back here just to raise awareness. Tell us what you will be doing with your classes.
So basically, I teach breastfeeding mothers, and because I've noticed there's a huge gap in knowledge in Nigeria. Like most of the stories I hear, moms that didn't achieve their breastfeeding goal is because of they didn't have the knowledge, they were not aware. So I'm just trying to bridge that gap, to educate and to encourage them and tell them of the things that are available that can help them and make things easier for them.
What has your experience been so far with because I know you go to hospitals to actually talk to new mums as well. So what has your experience been? Are people knowledgeable, or would you say that there's a lack of information on breastfeeding?
There is a big lack of information on breastfeeding. So I find that we're still moving around what our mothers did generations before, what my sister-in-law is doing, what my neighbor is doing. We're still moving within that circle, and without knowing that every mom is unique. Our breast size are not the same, our breast shapes are not the same, and the mother-baby dyad are never the same, even with the same mom and her different babies. So that's just basically trying to use one formula for everybody.
That's very interesting. So let's talk about the difference between formula milk and breast milk. So we all grew up with formula, I believe, like in Nigeria.
I actually am not knowledgeable of that. Yeah. I'm not sure what my mum did. I should ask her.
Yes,
but it's find out almost like the norm here in Nigeria. The formula milk is very constant here. And so can you tell us the difference between formula and breast milk?
So we'll start with, there's a huge difference between formula and breast milk. Breast milk is liquid gold, like there is really nothing else like it. And let's start with the ingredients. The ingredients in breast milk are much more, like when I say much more, not 2 times more, not 4 times more, like a lot more than what is available in formula. And as well, like there are some things that are in formula that we shouldn't be eating, like things like aluminium, chromium, some things that are harmful to our babies, but we are not paying attention to those because they need it in the powder to keep it a certain way. And the benefits of breastfeeding and breast milk far outweighs, and it goes not just to your baby at infant stage or newborn, goes to toddler age, to their adult age, and then the mom that is breastfeeding is also benefiting as well. So at the end of the day, your baby is being protected from the common illnesses because your baby is getting breast milk, whereas a formula-fed baby doesn't have those antibodies, doesn't have those living cells, doesn't have those stem cells that a breastfed baby is getting from breast milk. So they tend to get sick more often because their immune system, all babies, their immune system are not strong enough to fight anything. So the common respiratory infections, they are very prone to it. And you find that breastfed babies, because breast milk is never the same, it's not the same in the morning, it's not the same in the afternoon, it's not the same like as the baby gets older. So you find that there is a constant protection, whereas formula is the same. Every time.
So for women who aren't able to breastfeed, they're not producing enough milk, or they have issues with their glands in their breasts, what should they do? Because a lot of them actually want to breastfeed. So what are some of the options available to them?
Okay, so I just need to clear this. There's only about 1 to 5% of women that really are not able to breastfeed, are not able to have enough to satisfy their baby. So you find that many other women that feel they fall in that category, they really don't. So, but just that they had faced they have come across a hurdle and they just didn't know how to go through it. So, but for moms that have like insufficient glandular tissue, which is when you don't have enough milk-making glands in your breast. So we can always tell that just by looking at your breast, we can be able to identify that. So for those moms, I encourage you give your own breast milk because you can still produce, just not enough for your baby. And then second option is donor milk, because donor milk should be our second option before we talk about formula. So if the mom is able to reach out and access donor milk, that's what she should be giving before formula.
This is very interesting because that's what your foundation is about, right?
Yes.
The milk bank. Tell us about that.
So basically, just because I've had a few moms like this, and I really I can feel it in them that they don't want to not give breast milk. They're really wailing inside and they feel cheated on.
Yeah.
So I want them to have opportunity because I also have a group of moms that have oversupply as well. So, and they're willing to donate. I had to run a study and they're willing to donate. So if they're able to give me that and I'm able to test them beforehand. So basically for the milk bag, the moms that'll be donating, I'll be running a series of tests beforehand to be sure that they're not carrying any transmittable disease. And then after that, we take their milk in sterile containers and then pasteurize them and treat them before we can now hand it over to premature babies and hoping to reach to other babies as well, every baby.
So are you looking to relocate to Nigeria to start this foundation?
We have to.
But you're already doing it. You know, you're in Ireland, but you do come over to Nigeria to talk
I'm frequently here because of this.
Yeah.
Because I noticed the huge gap and I feel we really have to bridge that
gap. Yeah, definitely. And you also have an event that you had last year, which you'd like to do again this year.
Yes.
And you're doing that in, you're looking at Lagos, Port Harcourt.
And Abuja.
Yes. So tell us a bit about the event itself.
Okay, so this is the World Breastfeeding Week from 1st to 7th, and we're just doing event just to kind of do what? Encourage, create awareness and all that.
Yeah, and it's free?
It's free, completely free. And everyone is going home with a goodie bag and food and drinks and all that. So, but basically in Port Harcourt, we're starting off on the 2nd. And it will be in Braithwaite Hospital talking to moms. And then I come back to Lagos on Saturday in Landmark Towers. We'll start off with a breastfeeding walk. And after the walk, we'll be in the venue educating, like just have a good time with moms. And it's completely free. Then we now head to Abuja on the 7th.
Okay.
And finish it up there.
Okay, and you also have a website?
Yes. So my website is www.themilkbooster.com.
www.themilkbooster.com. Well, thank you so much, Dr. Chinny, and we'll have you right back for our take, right?
Yeah.
Just stay with us.
Yes.
Hold
up, no. There are a lot of mothers who want to reach out to you. They have questions. What is your social media handle?
So it's at @themilkbooster_.
Okay, for those of you who didn't catch it on screen, it's
@themilkbooster_.
Fantastic. Thank you so much for coming on the show. That's all from Dr. Chinny. Joining us next on the show is hospitality extraordinaire and founder of JobLink Foundation, Mary Dina. But before then, it's time for us to go on a short break here on The Morning Show. Don't go away.